So the next rhythm we're going to talk about is called a junctional rhythm. And junctional rhythm is abbreviated junctional rhythm like that, JR. It's also called a junctional rhythm. And what is different about a junctional rhythm from a sinus rhythm? Remember, our sinus rhythms all originate in the SA node, and then they come down to the AV node, go into the bundle of His, and then into the Purkinje fibers. What happens with a junctional rhythm is that the rhythm actually is originated in the AV node. So for whatever reason, the SA node is not firing, so the AV node is the source of the electrical conduction. So what we will have is either no P wave, so our rhythm would look something like this, followed by an right side up or positive T wave, and there'd just be no P wave, no PR interval, and no P wave. The other thing that can happen is we can have what's called a retrograde or inverted P, and it will look something like this. And again, your T wave is positive, but there is a retrograde P wave or negative P wave. So it can look either way. What happens is if the AV node fires and the impulse travels down to the bundle of His and then into the right and left bundle branch blocks and then into the Purkinje fibers, you will have no P wave. It'll look like this. If the rhythm, the impulse, leaves the AV node and it goes up towards the atria and down, you will actually have a retrograde P wave because you're looking up. So the lead is going to sense it coming up towards it. So it'll go up and then over, and that will give you a retrograde P. Now, what are the rules of junctional rhythm? If you pull out your rule sheet, you will see that a junctional rhythm, the R to R, is regular because it's a regular rhythm. Your QRS is going to still be the same. It's going to be less than or equal to 0.12. That's because the rhythm's coming out of the atria. Any rhythm that originates in the atria is going to have a QRS of 0.12 or less than 0.12. So R to R is regular, no P or retrograde P. You're going to have a T wave is present. And now here's the confusing question that I'm going to ask. What's your rate going to be? Well, how would you know? I haven't told you yet. But I want you to think back. What's your intrinsic rate for your SA node? 60 to 100. Everyone that answered that's right. Your AV node, what's the intrinsic rate on that? 40 to 60. So your intrinsic rate of 40 to 60 means a junctional rhythm's rate is going to be 40 to 60 because that's the normal rate that the junction can fire at. Under normal conditions, it's going to have a rate of 40 to 60. So it's a little bit slower. Remember, SA 60 to 100, AV 40 to 60, and when the ventricles do the firing, it's 20 to 40. So a junctional rhythm is going to be a little bit slower. Why does a junctional rhythm occur? It may be because the SA just didn't fire. Maybe the patient had a heart attack and it affected the SA node. Maybe they're on a medication that's messing with the SA node, so it's not firing properly. So the AV node is a backup system to the SA node, and it will produce junctional rhythms. So that is a normal junctional rhythm. You just call it junctional rhythm. Rate is 40 to 60. R to R is regular. QRS is less than or equal to 0.12. There is no P wave or it's retrograde, and the T wave is present. Now I'm going to show you an actual EKG with junctional rhythm. Now this one is a little bit irregular, and let's use this one because that one's hard to see in the dark. So here it is, and you can see that, I'll let it focus, there are no P waves, but the QRS is still thin, skinny. It's not fat because this rhythm is originating in the atria. And atrial rhythms always have a thin QRS 0.12 equal to or less than 0.12. So that's what a junctional rhythm would look like on a 12 lead. And again, you would use your 300, 150, 100, 75, 60, 50, 40 to determine the rate. Junctional rhythm 40 to 60.